Before we get started, I'd like to take a moment to recognize a couple of important observances happening this month that touch all of our lives in meaningful ways. First, September is Suicide Prevention Awareness Month, a time to raise awareness, promote hope, and remind everyone that seeking help is a sign of strength. Suicide affects millions of people each year, yet far too many struggle in silence. This month, we are called to recognize the warning signs, encourage open conversations about mental health, and connect people to proven resources. One of those critical resources is the 988 Suicide and Crisis Lifeline, which provides free, confidential support 24 hours a day, 7 days a week to anyone in emotional distress or to anyone worried about a friend or a loved one. Together, by standing in strength, dignity, and hope, we can make a difference and help save lives. And I've shared my story several times as a suicide attempt survivor. I share that story to break stigma and to bring awareness that when you have access to resources, or that it's okay to not be okay, but it's okay to reach out when you need help, and when you have access to resources, you can absolutely get the help that you need and live a full, healthy, and full life. I would also say that when it comes to resources, Franklin County has the Credible in Minds platform, but we also have our new crisis center that is open for anyone, so you will not be turned away. So please utilize that resource. We have Mental Health Mondays that you, Commissioner Boyce, I know, lead. Franklin County takes mental health very seriously, and we want everyone in our community to be able to thrive and not just survive. And so I don't know if my colleagues have anything to say about Suicide Awareness Month, but
Madam President, may I?
Absolutely.
Thank you so much. First, let me just begin by once again recognizing your courage and leadership for bringing the conversation of mental health to the forefront. I honestly, I kind of ran with the ball, but you are the inspiration around it, and your courage that you've shown in sharing your story publicly. I think it's hard if you're not in elected office, it's hard to help you understand that vulnerability and to be that far in vulnerability out there. I think in many ways you don't know it, but you're probably saving lives, and I want to recognize that. The second thing I want to say is that every mental health professional that I've talked to since we started our empowerment conference around mental health has said that mental health crises are on the rise. And that is, and I see Erica Jones here too, but that is an indicator that we've got some real work to do to ensure that our residents have the resources they need, that when they face the crisis, that we're a part of the solution, part of the resources. And that's, to Ms. Clark-Jones's effort, that's what the Crisis Center is all about. It's about being able to facilitate those crises scenarios to provide resources and services where they're needed instead of just locking folks up. And then the other layer of that is this unfortunate statistics around suicide. And so we're seeing numbers on the rise with veterans, with young people, with in different demographic and racial indications, all trending upward, that give us something to be alarmed about, but more importantly, to direct resources. So I say all that to say, while we're taking a moment to recognize Suicide Prevention Awareness Month, let us all think about our own mental health and prevent a moment of crisis by seeking help and resources that might be available to you now when it may not be at the crisis stage. So again, thank you for your advocacy. We've got a lot, advocacy, thank you. We've got a lot coming up around the Empowerment Conference and that we're going to do this year, and some other things we're thinking about, and hopefully, again, that your inspiration can help save some lives.
Thank you. Thank you for your leadership and continuing to move the conversation around mental health and empowerment.